Bismillahirrahmanirrahim. In the name of Allah, who is the most merciful and beneficial God. Assalamu alaikum everyone. This is Aisha Tariq and my ID is 220132310004 and my department is BS Biotechnology batch 13. Today I am going to represent the topic electroconvulsive therapy, which is also known as ECT. So this is the part 2 of electroconvulsive therapy. So first of all, we are going to talk about effects of electroconvulsive therapy. So there are two types of effects, like short-term effects and long-term effects. First, we are going to talk about short-term effects, which is nausea, headache, fatigue, confusion, drowsiness, slight memory loss, and long-term effects, which includes apathy, loss of creativity, drive and energy, difficulty in concentrating. So first of all, we are going to talk about the types of effects of ECT. So there are different types, in which first of all we are going to talk about memory problem. So many people face memory problems. ECT can cause temporary memory loss, particularly regarding the time around the treatment sessions. This is known as retrograde amnesia. It may affect both recent and distant memories. In most cases, these memory problems resolve within a few weeks or months after treatment. Let's move forward to the next slide, which is cognitive effects. Some individuals may experience difficulties with attention, concentration, and other cognitive functions after electroconvulsive therapy. These effects are typically transient and tend to improve over time. The most important area of cognitive effect associated with ECT is loss of autobiographical memory, which is distressing for some patients. Let's move forward to another type of effects, which is physical side effects. Many patients feels physical side effects. Electroconvulsive therapy can lead to short-term side effects such as headache, muscle ache, nausea, and confusion immediately after the treatment. These effects usually subside within a few hours. This is short-term effects. Let's move to the forward. Cardiovascular effects. Electroconvulsive therapy can cause changes in heart rate and blood pressure during the procedure. Patients are closely monitored to minimize any potential risks. Risks associated with anesthesia. ECT requires general anesthesia, and as with any surgical procedure, these are risks associated with anesthesia, such as allergic reactions, respiratory problems, or adverse reactions to the medications used. Effects of electroconvulsive. So, what is nausea? Nausea is feeling an urge to vomit. It is often called being sick to your stomach. What is the reason behind nausea? In electroconvulsive therapy, it is related to anesthetic, to the electroconvulsive therapy treatment itself, or to air in the stomach from assisted ventilation, as well as the muscle contraction during seizure. Nausea occur in 25% of the patient after electroconvulsive therapy. Mostly patients feel nausea. Next is headache. Headache is a short-term side effect after electroconvulsive therapy. It may end after few hours. What is the reason behind headache? 5-HT2 receptor sensitization has been associated previously with headache genesis, which may explain why electroconvulsive therapy induces headache. And amitriptyline relieves headache due to the muscle contraction during seizure. Next is confusion. Confusion or disorientation can occur immediately after electroconvulsive therapy. This side effect is attributed to the brief alternation in brain activity caused by the induced seizure. Next is drowsiness. It is a side effect which ends after few weeks. It is long-term side effect. Main reason for feeling drowsy after electroconvulsive therapy is the administration of general anesthesia during the procedure, which induces a controlled state of unconsciousness and can cause sedation and drowsiness. Next is apathy, that means lose of interest in many things. Apathy is a long-term effect of electroconvulsive therapy. The main reason for apathy after electroconvulsive therapy is not fully understood, but it may be due to the impact of the electrical stimulation or brain circuits involved in motivation and emotion. Next is drive and energy. Drive and energy is the term effects of electroconvulsive therapy. What is the reason behind this? The main reason for improvement in drive and energy level after electroconvulsive therapy is believed to be the therapeutic impact of electroconvulsive therapy on neurotransmitter systems, particularly serotonin, dopamine, and norepinephrine, which play a role in regulating mood, motivation, and energy. Next, voltage and time. Parameters: voltage is about 70 to 120 volts. What is the reason behind these voltage? Electroconvulsive therapy, the voltage used typically ranges from 100 to 450 volts. The specific voltage settings are determined based on the individual's medical history and treatment goals, and they are carefully monitored by healthcare professionals to ensure safety and effectiveness. It is the total decision of experts and doctors. The specific voltage settings are adjusted to achieve the desired therapeutic effects while minimizing risks and side effects. It is carefully controlled and monitored by healthcare professionals to ensure safety and effectiveness. Next, time duration. What is the most common time duration? The time duration is mostly about 7 to 1.5 seconds. What is the reason behind these times? During electroconvulsive therapy, the voltage is applied for a very short duration, typically a few seconds. The purpose of applying a brief electrical stimulus is to induce a controlled seizure in the brain. The seizure is believed to produce therapeutic effects for certain mental health conditions. The short duration helps minimize potential risks and complications associated with the treatment. Next, brain chemistry in electroconvulsive therapy. Electroconvulsive therapy is known to have various effects on brain chemistry. The exact mechanisms are not fully cleared. Here are some of the changes in brain chemistry that are thought to occur during and after electroconvulsive therapy. First of all, we are going to talk about the neurotransmitter level. So, electroconvulsive therapy can alter the levels of neurotransmitters in the brain, including serotonin, norepinephrine, and dopamine. These changes may contribute to the therapeutic effects of electroconvulsive therapy on mood and mental health. Next is neuroplasticity. Electroconvulsive therapy is believed to enhance neuroplasticity, which is the brain's ability to reorganize and form new connections. This can promote adaptive changes in brain structure and brain function, potentially contributing to improved symptoms and cognitive functioning. Next, we are going to talk about the hormonal changes after electroconvulsive therapy. So, electroconvulsive therapy may also affect hormones level such as cortisol, which is involved in the body's stress response. Electroconvulsive therapy has been shown to modify the release and regulation of certain hormones, which may play a role in the therapeutic effects. Next, we are going to talk about the neurotrophic factors. Electroconvulsive therapy has been found to increase the production and release of neurotrophic factors such as brain derived neurotrophic factors. We also called them BDNF. These factors support the growth, survival, and maintenance of neurons and are associated with neuroplasticity and also mood regulation. Next, we discuss about the recent research about electroconvulsive therapy. So researchers have been investigating variation in electroconvulsive therapy techniques to optimize effectiveness and minimize side effects. These includes examining electrode placement, stimulus parameters, and seizure monitoring techniques. There has been ongoing research to better understand the mechanism through which electroconvulsive therapy exerts its therapeutic effects. This includes studying changes in brain structure, neurochemistry, and connectivity, as well as investigating the role of the neurotrophic factors and inflammation. Research studies have shown that electroconvulsive therapy is the most effective and rapid treatment available for elderly patients with depression, bipolar disorder, and psychosis. For patients who suffer from intractable catatonia and neuroleptic malignant syndrome, electroconvulsive therapy can be life-saving and it proves very beneficial for many patients. So here are some references. I hope you will get it. Thank you very much. This is all from my side.